I would like now to introduce Dr. Mayada Abu Affan. And as I said earlier, all the bio of those, all people today, tomorrow, all of them are available online. Mayada is a senior consultant. She advises many organizations, including the WHO countries. And she's going to talk to us about a wider system approach to combating COVID from a wider perspective in developed or third world countries, or maybe developing countries. But we have put Mayada after Dr. Muhammad and Professor Ghazam, so at least she will have seen first-hand experience of those two countries. They both in Africa, but Libya also considered as an Arab country. Libya got its own challenges, and Nigeria. So, Dr. Mayada, the floor is yours.
Okay, thank you very much. This is my first presentation online, hence the hiccup. So thank you very much, Professor Alam and Watson, my colleagues, and it was a pleasure listening to everyone. I am going to talk about a system-wide approach. I'm going to look at why do we need a system-wide approach, especially in developing countries where the political, economic, healthcare, and social systems are not well developed, and also the what needs to be done, and then the how, and how the system-wide approach will work, and then the so what, which is the implications and the long-term learning from COVID. As you all will agree with me, COVID is a global pandemic at a large scale. The last similar scale was the flu vaccine in 1918. And then the high attack rate and the high mortality rate, especially on high-risk groups, forces us to think widely. It's to think beyond health. And as I said, it has a huge social and cultural implications and also economic implications, as my colleagues alluded to. So to be able to hit the ground running in countries where the health system is not well developed and other systems, we need to adopt the emergency planning and disaster management models. So this presentation is based on applying these models and identifying a system and suggesting elements of that system. In the main essence of an emergency planning and disaster management model is clear command and control structure, and having a strategic and operational, which we call them gold and silver cells or approaches. So what are those components of the system? As I said, in terms of the statutory services, okay, and also the non-governmental and societal. So the system is relying on the government, the NGOs, and the social system. In terms of like the strategic and the command, if we look at the command and control, if we look at the gold cell, what do we mean by the gold cell? The gold cell has to be chaired by or led by the highest rank in the government, a prime minister or someone who has been delegated to by a prime minister, and then it needs to have key components. Ministry of Health is only one of them. It needs to have the finance, media and culture, Interior Affairs, and Ministry of Education as main stakeholders and main partners, sharing the responsibility equally. And I'm going to reiterate this, COVID is not just a health problem. So what would be the function? What would be the overall responsibility? Not just the clinical management, but also resource mobilization, social management and social mobilization, developing recovery plans, managing the communication and behavioral change approach, as I'm going to discuss later, the role of communities, and also the enforcement and law and order that needed to manage such a high-scale pandemic. So the silver or the operational level, to be able to manage the problem from every aspect, these are suggestions of 8 strands based on the UK management, and as I said, hybrid and underpinned by the emergency planning and disaster management. We need the first strand is a manpower and clinical environment. Your staff, I'm going to go through each strand in more detail. And then the clinical management of the disease, the management of supplies and equipment, then your hospital capacity or secondary care capacity. You need to look at business continuity in terms of health and wider than health, especially when you have lockdowns. And then you need to really focus on your communication and how you're going to manage societal behavioral change, and then mobilizing communities. And then in the end, you need your research and development and also your recovery planning to be able to manage at such a high scale pandemic. So if we look at the manpower and clinical environment, this is your clinical staff, doctors, nurses, allied health professionals who are working in hospitals, in isolation centers. You need to have your know and monitor workforce contingency planning. You might need to redeploy staff who are working in cold cases to manage only COVID because you are going to stop other cold cases. You need to maximize preventative measures to protect your staff, the PPE to staff, and also all the facilities they are protected from the infection. And also you need to look at the logistics of the staff, their transport, their food needs, and how you are going to protect their families. For example, in the UK, some hospitals, they rented rooms, hotel rooms, and especially hotels are empty, so the staff can stay there and not go back to their families to reduce the risk of transferring the infection to their families, especially if they have high-risk families. And then the clinical management in a developing countries, you need clear leadership structure at the national and local level. You need a body that is responsible as a collective on developing clinical guidelines and management pathways. I know the WHO developed guidelines, but you need to customize them to the country and the culture and the law and enforcement of that country. And you need to keep them updated regularly. You need to inform the government decision-making process, the lockdown, when to ease it, what businesses to close, and what businesses to open. And also development of self-care and prevention guidance. COVID has put really strong emphasis on self-care of mild cases and self-care of the general population to prevent themselves from getting COVID in terms of maximizing their immunity and adopting the prevention messages and adopting like the public health guidelines in terms of smoking. So we were asking the population to reduce the smoking because it impact on their chance of getting COVID and also the severity of the disease. They need to manage their long-term conditions to keep up their immunities. They need to adopt healthy lifestyle and these things. And also this strand, they need to look at the infection protection and prevention guidelines and how they get adopted. And then the other strand is the PPE resources and oxygen. You need monitoring these supplies and ensuring continuous supply of equipment and medicine. The other side is the secondary care capacity. Okay, so you have your hospitals, and if you needed to do isolation centers, you need to take that decision. You need to monitor your hospital capacity, ICU, intensive care unit capacity, and you need to develop alternative pathways when capacity is exceeded. If this hospital is full, then you need to know where you can divert patients. business continuity, and I think this is the most important, and it was one of the major challenges in the UK, which is how you ensure you continue to manage non-COVID patients, so so people won't die because of heart disease or a stroke, because all services are focused on COVID. So that's a very important strand. And you need to think: do you need to have separate health care facilities for COVID and non-COVID, or you can have them both in one facility, but with clear demarcation between the two, and making sure that patients, non-COVID patients, are protected. And I think one of the most important uh, 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 strand is managing communication and behavioral change approaches. And I don't think many of developing countries have managed to use this effectively. So you need to utilize the maximizing utilization of mainstream media, social media, and community leaders to influence behavioral change. People, they have to know the epidemic curve, and they have to follow it and know where they are in the epidemic curve, because it will give them an idea of the start, the peak, and the end. And also, they have to know the situation on secondary care. What is the hospital capacity? So they make sure that they don't increase the pressure on secondary care, and that they can manage themselves. So this is where you manage demand on healthcare facilities. And also you want to enforce the prevention messages, like the hand washing and distancing and all that, and then enforce the law and order, or remind the population of the law and order messages. Then community mobilization, because as I said, COVID, in terms of capacity, workforce capacity, and in terms of economic capacity, really have passed all economic systems and healthcare systems, even in the UK. So you need to look at volunteering capacity. No system was able to manage COVID alone without looking at volunteering and looking at community mobilization. And then in terms of the volunteering, not just volunteering in terms of manpower, but also in terms of donation, money, food, and equipment. I remember Siham talked about food banks and these things. For example, in my area, we as a local government, we got lists of all vulnerable people who are shielding or not allowed to go out. And the ones who don't have money, we provided food supply for them, delivered to their home, so they don't have to come to the food bank. So, and then we developed interventions to improve social cohesion, especially older people who are sitting at home scared and being told not to go out for at least 3 months. If they don't have family, we used to call them and make sure they are fine, and we encourage neighbors through the media to check on others by social media and by phone. So the community mobilization is really an important element within COVID management, and within third world domain, because you can rely on non-governmental organization, or you can rely on the communities. Communities back home are very well connected, and they are able to look after each other if they are given the guidance and have been shown how to do that. And the last strand is research, development, and recovery. We need each country needs to develop its own local trials and try its own medicine. Because of the impact, there are a number of COVID strains, and some countries hit harder than others. There is the impact of racial and the impact of long-term conditions on COVID. So you cannot rely on, for example, UK trials alone. And also you can take part or taking part in international trials. And then the recovery planning. When we look at recovery planning, it has to start from the beginning when it's declared as a pandemic, and we need to look at different recovery time frame and severities, and also different scenarios of the new the new now, okay, or how the new future is going to look like. So, and so what? So, by adopting this system-wide approach and by utilizing emergency planning and disaster management, we are able to address all aspects of the pandemic: the clinical, the social, economic, and cultural. And also by thinking about the recovery plan at the start and having different scenarios will enable us to manage recovery at the moment we start to that recovery. And then we need to learn from COVID. So the like food for thought I will leave you before lunch are, in terms of the things we are going to take from COVID long term, are the infection prevention and protection measures. They are here to stay. The hand washing is here to stay, and to some extent the social distancing and the respiratory hygiene, also the role of community cohesion and solidarity is something we can take, and it's something to stay, not just in the future, not just in managing like a pandemic, but also in managing long-term conditions and other health challenges. Thank you very much.
Okay, Siham, Mayada, thank you very, very much, Dr. Mayada. If I can see, or I can get all of you, if you can stop the sharing of the screen, Dr. Mayada, so we can go back to all of them. Now, thank you very much, Dr. Mayada. I think that was very interesting, very inspiring. I think it's very good to see the connections between what she mentioned, Dr. Mayada, and what Dr. Mansouri mentioned about business. Mayada talked about the business side, which she said is very important. She also talked about research and development, which Professor Gazzama also mentioned. Professor Gazzama and Dr. Muhammad Al-Mansouri. Now, I would like to open it for questions. I have questions here arrived because, you know, we're following this on the Facebook as well. If there's anyone have any question for any of the three speakers, Dr. Mansouri, who talked about the impact of COVID on SMEs, small and medium enterprises in Libya. Professor Gazzama, who talked about the impact of COVID in Nigeria, but it's quite generic, although it was referring to Nigeria, but he referred to research and development and so on. Dr. Al-Mansouri, can I'm trying to unmute you. Now, Professor Gazzama and Professor Muhammad Al-Mansouri, if you can just show on the screen on the video. Now, any question? If you would like to ask any questions, just raise your hand. Now, Professor Gazzama, I got a question here for you. I can't just see you, Professor Gazzama. Can you hear me? Professor Mayada, sorry, I will come back to you. Apologies for that. Professor Gazzama, just a quick question. Dr. Mayada have just talked about research and development, which you did explain about it, but given of your wealth of experience, you know the UK very well, you know all these policy and directorate here in the UK. To what extent you in Nigeria have seen what Dr. Mayada have said about this much more generic approach to, or a wider system approach to third world countries, Nigeria is an example. Do you think there is one approach can really be adopted across all, say, Africa, for example? Or do you think each country, it has its own, its country-specific perspective? For example, Nigeria, Libya, Sudan, Egypt, South Africa. Do you think we could adopt one approach or a wider system approach to all these countries the same?
Well, Mr. President, I don't think there is a lot of collaboration at the present time. But really, I feel that AU should be a central point where everybody will come and pick whatever is appropriate for that country or for that region. But it has not been happening. It's unfortunate. But I also want to ask my previous speaker on the matter of the race thing. I know I listened to you some time ago, fantastic debate by Farida and her associate on why some races in Britain also have contacted this disease and they have died more than other races. I don't know. I don't think it's genetic. I would have liked my co-speaker to talk on the environmental issue. I think there is a lot of concern on the environment rather than the racial aspect. Thank you.
Okay, thank you. Mayada,
But from your question.
Yes. Yes, Professor.
From your question, we need for African Union to be more proactive, to bring more togetherness so that we can learn from each other. Take, for example, this the green wall from Somalia to Senegal. There is nothing that has tied Africa together like that one, because everybody is interested in the Sahelian zone. You see, so African Union should do more of bringing us together to learn from each other. Thank you.
Thank you, Professor. Mayada, before I come back to you, maybe I ask Muhammad al-Mansouri. Dr. al-Mansouri, can you hear me? Dr. Muhammad al-Mansouri, can you hear me? You hear me, Doctor? Dr. al-Mansouri, can you hear me? I mean, Libya really having a serious problem with the internet. But let me go to Mayada. Mayada, there's two questions here. One of them is, before we come to the black or the ethnicity issues to do with COVID, but this is definitely a question is being going on and on, even after we brought Professor Farida and Suhair, and they discuss it. Still, we have these questions. But before that, Professor Gazzama said to you, the big problem is really collaboration. He said he can't see collaboration in African Union. Of course, you cannot comment on the African Union or international collaboration. But to what extent do you believe why the system like yours, which you are talking about, needs a regional and maybe continental collaboration in Africa, in Middle East, or in Asia, whatever it is, because this is a wider system. So the more you can get more people to apply it is better. And on the second part, if you can respond to him, but if you could really be as, I know it's quite difficult to put you on the spotlight, but some people, they said has nothing to do with genetics. And we have listened to some reports, even from in this country, they saying, maybe the blacks, they are getting it because of vitamin D and so on and so on. I don't know, there's lots of things going on. The NHS, they have their own report, which you know it better than me. So do we really, those black people or those from particular ethnicity, are more susceptible to get this COVID or not? I think that question is still for an ordinary person, he needs or she needs a much more easy answer. I know you're going to say this and this, but if there's any easy answer, we will say yes, because black people, they will get it more because of this, or maybe Asian people or whatever, why they get it more or less. Whatever it is, the answer, the more easy and simple for an ordinary people who are watching us will be better. So go ahead, yeah, Mayada.
Okay, thank you. I'll address the collaboration question first. What I wanted to say and the take-home message is COVID is beyond health. Okay, so within one country, they need to collaborate and collaborate very heavily, and they need to own the problem. And in the suggested structure is the goal has to be chaired by the highest rank in the government, that because of the power. Okay, but who would convince the governments to adopt that approach? I think something like the African Union or even the WHO. All the WHO guidelines was on the what. It didn't go into the how in that details. It didn't stress the system-wide, the need to utilize your law enforcement as well as your media, as well as the economy, as well as the communities and the volunteering. Not just volunteering for workforce, but volunteering for money. So yes, collaboration at a local level, and then at regional and international and global level. In terms of the ethnic minorities, there are many theories. So there are facts and there are theories. The facts are the infection rates amongst BAME, which is Black, Asian, and minority ethnic groups, is higher. And the mortality and the severity of the infection is higher. So that's proved by statistics. The question is why? There are many theories. Some of them is because some of the long-term conditions like diabetes, like high blood pressure, are more higher in ethnic minorities. So their immunities is already compromised. Okay, and this is why. And another theory is people from ethnic minorities are most of them low-rank frontline workers. So they are likely to be exposed to the infection more than people who are affluent. Because if you look at the history of COVID in the UK, when it started in February, it was among the affluent people who managed to travel into the skiing resorts or coming from China on holidays, and they got the, but once the community transmission started, it became the disease of poverty, because people cannot shield, they have to work. So these are really the theories. Genetic, probably because of the long-term conditions, and poverty is associated with obesity and unhealthy lifestyle, with smoking, and these are all magnifying factors or risk factors for severe disease, and also them not being able to protect themselves.
Okay. Now, Mayada, just maybe to finish this question, but let me just check on Muhammad. Dr. Al-Mansouri, can you hear us okay? Dr. Muhammad Al-Mansouri.
Trying, Dr. Alam.
We can hear you. Can you hear us?
Okay, yes.
Yes, Dr. Muhammad, can you comment on this, given that you are in Libya? To what extent you agree with what is Professor Godzama said, and also Mayada now just said, Dr. Mayada, collaboration is a key to get us out of this, particularly country like Libya with all these challenges. If they can collaborate maybe with North African or African or others. Muhammad, can you hear us? I mean, you can see the difficulty, the challenges. I can see him, we lost him completely. But I think we already, I think 15 minutes or 20 minutes above our time, but the good thing is we already have 1 hour for lunch break. It's now being cut short down to half an hour. I would like to finish this session by thanking gratefully all our speakers who joined us from Libya. Dr. Muhammad Al-Mansouri, senior lecturer from Umar al-Mukhtar University. He is an experienced academics and practitioners in small and medium enterprises and innovation. And also Professor Godzama, who joined us from Nigda Godzama, who joined us from Nigeria. Professor Godzama is a well-distinguished internationally zoologist and also environmentalist. He used to be the vice chancellor of the University of Majuri. He's a well-respected academic worldwide. Dr. Mayada Abu Affan, who joined us from Birmingham. She's a well-respected consultant in public health. And I think the message we get from Mayada is quite important. We said this earlier and all along, the combating COVID is not a health issue, rather than, it's not a health issue alone, but it's a more wider issue. And it needs a public health perspective, a public health vision and direction, like what Mayada said. We need all to work together. Earlier, Dr. Siham mentioned about, we asked her about how New Zealand managed to be as an example of combating this COVID-19, and she said solidarity, respect. So the issues she referred to, they are not really medical terminologies, but more of social science issues like solidarity, respecting each other, working together, teamwork. She mentioned teamwork. Teamwork is something normally we teach in business school rather than in medical school, although medical school they do. Now, Muhammad Al-Mansouri, can you hear me? Well, I can see you now. Dr. Al-Mansouri, can you hear us? I think we have to finish the session here. I think it's exactly 3 minutes to 1 o'clock. Muhammad, can you hear me? I'm just trying to give you the last chance. We can see you, but we can't hear you. Can you hear us? So if you could join me, all of you who are watching in the normal way, I wish we have been physically able to see this to show them our appreciation to their talk. But if you could just all thank you them with me from all your places. Thank you very much for all of you, and we will see you in half an hour.
So please remember, if we all help and do a little bit, it will make a big difference.